peroneal and the tibial nerves way down here if you're just talking about foot or ankle surgery. But if you're talking about doing knee surgery of some sort and you're blocking all the way down here, is that going to do you any good? No, because your pain takeoffs would have already been there. So you need to kind of move up. So, all right, so say we're doing an ACL surgery with a cadaver graft, right? We can just move up a little bit, 5 or 7 centimeters up the leg, block that sciatic nerve there, and be good. But what if we're doing hamstring strippings? Have you all seen that in the ORs yet? Dude, it's brutal. So they'll come through and they'll actually they'll strip the hamstring, and that rod is about 20 centimeters long, right? And they'll grab a piece of that hamstring and they strip it all the way up to about here. And so if you're blocking your sciatic nerve here, you get great coverage here, but that hamstring stripping you're gonna miss. So then you either gotta go to a subglute or a transglute approach to the sciatic nerve. And it all just depends. You can find it anywhere in along there and block it anywhere in that orientation. It just depends on what your target is or what you're trying to block it for. Where that can go. There it is. So when we're looking for target in Chick-fil-A, external anatomy, she's in a perfect position. Notice how her leg is just kind of naturally bent a little bit. If you hyperextend the knee, it makes it a little tougher to image. Just a slight bend in the knee does a great job, because not only that, it helps you kind of find that natural fold, that natural crease in the popliteal area. So I'm going to orient myself correctly this time. I'm going to be, the right side of the probe is going to be in my right hand, because my right hand is going to be my needling hand. Notice how I've changed the approach to how I'm holding my probe, right? Normally when I'm on the upper body doing that kind of stuff, I'm holding like this, right? So I can get that orientation. But now if I did that, notice what I'd have to do to my hand, right? So notice that weird angle that I'm gonna be in. So I'm gonna change and I'm gonna just underhand it. And I'm gonna apply my force right here. So she has a little genetic variability. You're special. You already knew that though, right? So notice how she has the artery sitting right here in the center, but 1, 2, 3, 4 takeoffs already on her popliteal vein. So she has a lot of vasculature sitting around there. So notice what I'm doing with my hand again is not only do I have my hand kind of sitting way back here on the probe, I'm actually taking this finger and I'm stabilizing my grip up on this hamstring. She can probably feel me right here on her hamstring. What I'm going to use that finger for is it's going to be kind of like a train track. So I'm going to be using that finger to index myself, so that way as I slide up her leg, that I can go ahead and keep in a straight motion up her leg. Because what happens if you don't have something to kind of hold yourself medially or laterally